Welcome to the Bluewater Health pre-operative learning module for patients receiving total shoulder and reverse total shoulder replacements. Today you will learn about your surgery, what to expect after your surgery, and how to prepare beforehand to have the best possible outcome. At the end of this presentation, there will be a short quiz to make sure you understand all of the information. Preparing for surgery. Shoulder precautions. You will wake up with your Dawn Joy Ultra Sling on. Your surgeon will direct you on when you can remove the sling and how long you need to wear it for. Generally, you will need to wear the sling for 6 weeks and only remove it for exercises, bathing, and dressing. Equipment needs. It is important to think about how you will be moving after surgery to determine if you will need any safety equipment in order to access your home environment. Make sure that you can get in and out of bed, on and off the toilet and chairs, and in and out of the shower or tub without using your operated arm. If you have difficulty, consider renting or purchasing equipment to help you manage. Equipment needs. Some commonly needed items are raised toilet seats and toilet frames, grab bars by the toilet or in the shower or tub area, shower seats or bathtub transfer benches, depending on bathroom facilities. You may also find a reacher, sock aid, long-handled shoehorn helpful to increase your independence with dressing. There are all kinds of different aids to assist with managing daily tasks when handed. Think about tasks that will be difficult for you in advance of your surgery so that you can prepare. Rental and purchase locations. There are a few local stores where you are able to rent or purchase equipment you need. They are listed on the slide. If you are from out of town, please review the stores in your local phone book or search for them online. Definite equipment needs. Dawn Joy Ultra Sling 4. Please ensure you are properly fitted by a vendor for this sling. You can find instructions on applying and adjusting the sling at this link. Be sure to bring the sling to the hospital with you on the day of your surgery. Please see slide 7 for a list of vendors in Lambton County. Make sure to bring comfortable clothing to the hospital for your surgery. Clothing such as closed-toe and heeled shoes that fit well and stay on while walking, stretchy or loose-fitting clothes, especially shirts. Driving and car transfers. Your surgeon will advise you when it is safe to drive again. Generally, after a shoulder replacement, you will not be able to drive for 6 weeks. Please be sure to check with your surgeon before you start to drive. Listed are the steps to safely access your vehicle. It is a good idea to practice this before surgery without using the arm that is to be operated on. Community supports. Before your total joint replacement, you may want to arrange for transportation. Remember, you are not allowed to drive until cleared by your surgeon. If you are anticipating you might have difficulties, or if you live alone, you may want to look into assistance with meals or prepare and freeze meals before your surgery. Also, you can look into booking a respite stay at a local retirement home. Respite stay. If you do not feel that your home is a suitable environment to return to after surgery, consider staying with someone who has a more accessible layout. Alternatively, you can consider a respite stay in a retirement facility. If you would like to have a respite stay following your surgery, you will need to contact the homes directly and make arrangements before your surgery. These stays will be at a cost to you. Pre-operative exercises. Before your surgery, you can do exercises to maintain mobility in your shoulder in order to prepare for and make it easier after surgery. Please ensure your focus is on exercise that does not increase pain in your shoulder. For a complete list of exercises to do before your surgery, please refer to your total shoulder replacement booklet. While in hospital. Parking. Bluewater Health has parking available with a maximum daily rate of $8. Pain control. After surgery, our goal is pain management, not elimination. The surgical team will provide you with medication to keep your pain under control and allow you to begin your rehabilitation. After surgery, your nurse will check on you and encourage you to open and close your hand on the operated arm for circulation. Approximately 4 hours after surgery, nursing staff will help you up into a chair or walk with you into the bathroom. Occupational therapy. The occupational therapist will meet with you to review how to safely get dressed and bathe after surgery. You will need to keep your incision dry for the first 2 weeks after surgery, and after that, you may need safety equipment to access your bath or shower. Many people require assistance with dressing and bathing initially, so have your coach, family member, friend, or paid service arranged if you feel you need help with your personal care. Dressing after surgery. Shirt over sling. The easiest way to dress is to wear loose-fitting clothing over your sling. Pictured are the steps for doing so. If you want to wear a shirt under your sling, you will need assistance from someone to carefully support your operated arm while the sling is off. The steps are outlined on this slide and in the next. Dressing after surgery, sling removed. Practice the method you plan to use before your surgery, using the instructions from your total shoulder replacement booklet for guidance throughout the steps. Reviewing your home environment. The occupational therapist will review your home environment and assess your functional abilities to ensure you have the proper equipment in place and may recommend additional equipment that may help you to be more independent and safe. Some suggested are listed here to help you ready your home, but this is not an exhaustive list. The occupational therapist can discuss strategies that apply to your specific home setup. Reviewing your home environment. The occupational therapist will review your home environment and assess your functional abilities to ensure you have the proper equipment in place and may recommend additional equipment that may help you to be more independent and safe. Some suggested are listed here to help you ready your home, but this is not an exhaustive list. The occupational therapist can discuss strategies that apply to your specific home setup. Physiotherapy. After surgery, your physiotherapist will review the type of shoulder replacement you had and that you are to keep the sling on at all times and only remove it for bathing, dressing, and exercise. You are not to move or use your newly replaced shoulder for 6 weeks. The physiotherapist will show you the easiest way to open your sling to do your elbow, wrist, and hand exercises at home. Remember to continue to do these exercises at home to prevent stiffness from sling use. In addition to teaching you exercises, your physiotherapist will review how to get in and out of bed with your sling on, ensure you are mobilizing safely, and that you can manage going up and down stairs if required. Walking. Physiotherapy will assist in regaining your mobility after surgery. If you required the use of a cane or walker prior to your surgery, your physiotherapist will work with you and your surgeon to determine the safest way for you to walk. Discharge day. Day 1 after surgery. Discharge day. Most patients return home day 1 after surgery, not including the day of surgery. For example, if you had surgery on Monday, most people are discharged home on Tuesday morning after you are seen by occupational therapy and physiotherapy. Your nurse will go through all discharge instructions, including follow-up appointments and medications. After discharge. Home care. Generally, most people are moving well enough that home care is not required after a total shoulder replacement. Home care may be utilized on a case-by-case basis, and needs will be assessed by the surgical team. Outpatient physiotherapy. Total shoulder replacement patients will not start outpatient physiotherapy until week 6 after surgery. Please call 519-464-4400, extension 8100, to book your appointment once you know your surgery date. If you choose to attend physiotherapy outside of Bluewater Health, you can arrange your own physiotherapy at a clinic of your choice. For a complete list of clinics, please refer to the link on the Bluewater Health website or the leaflet located in the Total Shoulder Replacement booklet. Patients from out of town. If you are from out of town, you will need to book your own outpatient physiotherapy. Your surgeon will provide you with a script when it is time for you to start therapy. Please call and book your appointment in advance so you will be able to start physiotherapy once your surgeon deems you ready. Please refer to your local phone book or complete an online search for a listing of outpatient clinics near you. What to expect. Your incision. Your incision will be closed with staples. The staples will come out approximately 14 days after surgery. You will have a bandage on your incision before you leave the hospital, and it is to stay on and only come off if it gets wet or falls off. Please monitor your incision for signs of infection and notify your surgeon if you are concerned if you have an infection. Signs and symptoms to look for are pus, excessive drainage or foul odor, extreme pain, swelling, redness, or fever. Pain. Please use your pain medication, rest, and ice to manage your pain. You should expect to have some pain, swelling, and tightness for several weeks after your surgery. Quiz. Please take a moment to take this quiz to test your knowledge of your upcoming surgery. Please take note of your answers to these true and false questions. Here are the answers. Thank you. If you have questions or concerns, don't hesitate to call 519-464-4400 extension 8100 and ask for Adrian.